Psychological professionals provide a safe space for service users and team members. They are extremely approachable and offer specialist psychological advice and support to clinicians, both inside and outside of the team, to support the patient journey and staff wellbeing. The work they do has such a positive impact on our service users and their families. This can be seen in all the great feedback they have received. The benefits can also be seen within the wider system through collaboration, shared learning and partnership working. Psychological professionals continue to work with our midwives and people with lived experience to create trauma-informed training, helping to reduce the chances of birth-related trauma in the future.
We offer specialist psychological therapy to those that have previously fallen through the gap within perinatal, including those who have had multiple miscarriages and have moderate to severe mental health problems because of this. Many are continuing their fertility journey and may repeatedly go through re-traumatising experiences and further loss. The work we do together can help their well-being. I'm fortunate to be part of a team that can now support these women and hold the hope for them. I'm aware that miscarriage, stillbirth and baby loss is often a taboo subject within the community, and I want to help reduce the isolation and help women through the grief. We're very fortunate in being able to work closely with our colleagues, the specialist midwives, and this is invaluable in helping women and birthing parents to understand their experience and, if they decide to, prepare them for further pregnancy and labour. They also liaise with other health professionals in the maternity and wider healthcare system, which can help demystify problems, share knowledge, and we learn from one another.
I value having a varied role within the team, being able to offer one-to-one therapeutic work, supervision, training, consultation and reflective practice groups. I'm passionate about using a relational approach and building trusted therapeutic relationships with clients. I'm also keen to understand how trauma is stored in the body and use this knowledge to support those to overcome their trauma experiences using interventions such as EMDR.
I'm a CBT and EMDR therapist at the PATH's Maternal Mental Health Service. I use these models to provide a trauma-informed psychological approach to women, ensuring their treatment planning is holistic to their needs. Part of the work that I also do is I work really closely with our specialist midwives, enabling women to engage in exposure visits and helping them feel more confident in environments that have previously been highly anxiety-provoking or traumatic for them, as well as supporting them on their individual therapeutic goals. I also have a specialist interest in supporting women with birth injury, and I'm currently developing relationships with third sector organisations to provide knowledge and also set up peer support within this client group. The idea being to help women feel less isolated and supporting them to advocate for their voice to feel heard and empowered as well. I absolutely love working for the PATH's team. It feels so rewarding to help women at a time that feels so isolating for them. And I've seen such a positive impact that this has had not only on them, but on their wider families too. It also feels really empowering to support the wider systems and continue providing more trauma-informed support from that perspective as well.
I just wanted to say how much I really value working with the psychological professionals in the team. They've really helped me to grow my understanding of trauma and how I communicate with women, and it's really helped me to reflect on my own practice and the support that I give women emotionally. I think there are many benefits to integrating psychological professionals into the reproductive knowledge that we have as midwives. For example, the joint work we do on birth planning. This approach really helps us to improve the quality of care that women and birthing parents get as a result.
I wanted to share my thoughts around working alongside the psychological professionals in the PATH's team. It really has been valuable and it continues to develop myself as a midwife. It's deepening my understanding around trauma-informed care and the nuances around communication. I think one of the overriding messages that I have received from my peers and colleagues within the team is around the importance and the value of validating and listening to people's experiences. It's through this developing of my communication skills that I feel that we're able to offer a much more personalised approach to care. It's collaborating with the team that we're able to support maternity units and reflect with other midwives and really spread the message around trauma-informed care.
In my role as clinical leader, I support the team to develop pathways, ensure quality and keep safety and compassion at the heart of what we do. I enjoy working as the lead for a regional service with the opportunities it brings for developing partnerships and working on shared ambitions together, such as tackling health inequalities. Offering psychological interventions as we do is hugely rewarding because it has benefits not just for the person in front of us, but for their families and society too.